I'm Bonnie Feldman, also known as Dr. Bonnie 360. I'm having a wonderful time. The symposium is great. It's one of my early experiences with the pharma community bringing this message, and I'm hoping that more of them will hear it and participate. The keynote actually evolved as a process. Originally, I was going to speak about using big data to personalize the healthcare experience, but in my latest research, I uncovered a large and growing need in the autoimmunity community. And when I went to speak to all the cancer people using big data, no one had really thought about what I perceived to be a large and growing problem. So the keynote evolved into a different topic, which was called using precision medicine to help in autoimmune disease. It actually looked at how we can use data and digital tools to ignite precision medicine in autoimmune disease. And what most people don't know yet, and I hope will be one of the takeaways from the keynote, is the size of the growing need and the problem. There's actually 50 million people who have autoimmune disease. There's more than 100 different kinds of autoimmune diseases and more that are coming to awareness every day. And the average spend of these chronic disease patients is over $100 billion a year. And most people think the cancer market is larger, but actually they spend about $57 billion a year. So there is this large and growing need with the beginnings of a very vocal patient community, but not yet, the science isn't yet advanced enough to really be moving along in the pharma community, which is why I came to this meeting.
Great. So that's what you would like them to take away from your talk?
I would like them to take away that there's a large and growing need in the autoimmunity community. That means taking all of autoimmune diseases as a constellation, and we need to do something about it.
Now, I also noticed you were on a panel yesterday, and what did the panel discuss?
The panel was an extension of this theme that I had developed earlier in some work I had done using big data to personalize the healthcare experience. And my original work on that was research around how to use big data to personalize the healthcare experience in mobile cancer and genomics. And this panel brought 4 different perspectives from different sides of the industry on how we think about personalization. It was very interesting because each panelist had a pretty different type of view of the same problem.
Sounds like a bunch of economists up there. Now, but that was an interesting session. I was there, so I saw that there was a lot of participation. Anything that stood out as far as questions from the audience?
The overriding theme is we need to work faster, better, cheaper, and get this done now. That there's a growing demand, that everyone realizes that from a variety of viewpoints, medicine is not customized to each of us, and we're getting used to having a customized world, and we want it in medicine.
That's an interesting point. Now, last question. How are you doing at the symposium? What do you think?
I'm having a wonderful time. The symposium is great. It's one of my early experiences with the pharma community bringing this message, and I'm hoping that more of them will hear it and participate.
Fantastic. Thank you very much.